And now it's our great pleasure to welcome Neil Meltzer, the CEO of LifeBridge Health. Hi, Neil.
Thank you, Scott. Appreciate being here.
It's always a pleasure to see you, and especially, we've been in touch over the last few months and throughout the crisis. But wow, what a few years it's been, especially in the healthcare space. And it's particularly interesting today as we talk about how you started at the beginning of the pandemic. You had just minted and launched your purpose inside of LifeBridge to your own people, and then of course externally. I'd love to understand how your vision matched with your purpose and Care Bravely, which was the way it was crystallized and to the people inside the organization. I'd love to understand how you sort of saw those two things coming together, and if you felt that Care Bravely helped you achieve your vision.
Absolutely. Every great organization that I'm familiar with, at least, has at its core a set of principles or behaviors that really define it. And as a group of entities, LifeBridge Health was stitched together through acquisitions.
Hmm.
So those principles, those behaviors weren't as strong at LifeBridge as I wanted them to be. Especially if we were going to succeed in making our communities a healthier place to live. So what had historically differentiated us and really given us purpose had started getting diluted as we became bigger. Or it was simply evolving, and it really couldn't be articulated by our frontline caregivers, the very people that we rely on. And I wanted everyone in this organization to know what we stood for and why it should matter to them, our patients, their families, and members of our team. This identity, as I look at it at least, guides an organization as large as ours, and it really becomes the filter through which we run strategic decisions. If we were to deliver our promise of exceptional care and stand out and compete in a very crowded mid-Atlantic market, creating that strong identity was and is really critical to achieving the rest of our goals.
And talking about goals, um, how did Care Bravely help you achieve them, and did they help you achieve your business objectives?
Our Care Bravely movement was designed from the outset to deliberately stand out. Whether you're a consumer or you're one of our team members, the way healthcare has traditionally communicated often lacks real differentiation or emotion. Although large, we're smaller by comparison to some of our peers. So when we invest in communication, our efforts have to, what we say, punch above their weight and draw the attention we need them to. To this end, we consistently outpace larger competitors when it comes to our market awareness with consumers. But awareness is only the initial step. It's really the top of a healthy business funnel. So Care Bravely also serves as really a call to action to our team members. Once a consumer walks through our doors, how are they being treated? Are they being treated with care and compassion? Are we going that extra step? Are we putting them at ease? Care Bravely asks, are you going above and beyond? Now, while we still have a lot of work to do in this area, we can now point to a simple identity that team members can use to challenge their own standards and push to be better for our patients.
So while we're on the subject of Care Bravely, could you just tell us for a few seconds what is Care Bravely and how are you using it to drive positive change in your where you operate in Maryland?
What's a little bit different is that historically, our industry tends to focus on clinical treatment, not on prevention or addressing some of the psychological or social issues at the root of many problems, or what we call the social determinants of health. As an example, last week we had the grand opening of our new $12 million building called the Jill Fox Center for Hope, which houses the nation's leading domestic and child abuse resource and training center, as well as a variety of other violence interruption and community service organizations. Now, while each entity is different, they all have the same goal: help people impacted by trauma by providing the care they need. And while the work these people do sometimes involves clinical exams, that's not why they're there. They're there to impact people's lives and make the communities they live in better. So by treating thousands of children, families, and abused elderly every year, the Center for Hope becomes an integral part of LifeBridge Health, and I think illustrates perfectly how our mission to care bravely and to create healthier communities doesn't just demand great clinical care, but also deliberate community investment via non-traditional paths. I think that's probably the most recent and best example I can give you.
Amazing that you have that the Hope Center and that they're engaging in the community that way. People talk a lot about actions. That purpose activated with actions really drives the kind of engagement that drives the positive change that you're trying to achieve, and especially when it comes to your own people, employees. Maybe you could turn your focus from the external to the internal for a moment. How is Care Bravely galvanizing the people that work for you, especially coming out of COVID and even during COVID, but especially coming out of COVID? How did they respond during COVID, and how are they responding now I mean, COVID's still here, but we're looking at perhaps a bit of a different world today.
I've been in this field. I've been in a leadership role for well over 30 years, and one of the things I've learned, and it's been reported and studied, is that people without a purpose at work tend to be less happy, less satisfied, more likely to leave, and generally aren't performing at their best for our patients. So there's a real need. There's a real need for what Care Bravely brings: a common purpose and a sense of what we do matters. As a health system that's grown through acquisition, and one with urban and rural components, it's really helped us bridge that cultural and ethnic divide that already existed. And it introduced a common vernacular that everybody understands, regardless of where they come from. While it's one of the many tools leaders can use, a common purpose is really critical, in my view, in getting people and organizations pointed in the same direction and willing to explore new relationships, ones that start out with something in common. And I think that was really the foundation for Care Bravely.
Some leaders say purpose activated helps drive new types of behaviors and actions with their employees, but oftentimes it also helps you frame stories from the past that help people see where you're coming from. Do you have any examples of a story from the past that you were able to use to demonstrate that you have a legacy of caring bravely inside the organization?
Well, I think one of the great things about our organization is that we've been community focused for a long time. And some number of years ago, I actually turned to the employees and said, they need to help us define what our purpose is. And through a whole series of meetings and discussions, it was the employees who said that we are an organization that helps communities heal, basically. And it was they who determined what our purpose ought to be. And we wove that purpose statement through the organization for many years. As a result of that, we created about 45 community service programs that are addressing many of the ills of our local community. So much of what we do is really based outside the four walls of the hospital. I'm really proud of that. I mean, there's an example I can give you about something that we call hotspotting. I'm an old public health guy. So we have, I asked our employees to find 100 people who had been in the hospital 3 or more times in the emergency department. And they found a woman who had been in the emergency department for, it was literally 100 times in a year. We did our first home visit and found that she was a fragile diabetic, single mom, 2 kids, and we realized she didn't have a working stove. So we ended up taking my charge card and buying her a stove, gave her 3 nutrition lessons, filled her refrigerator with healthy food, and we do weekly home visits to her at our expense. But as a result of that, this woman has not been back to the hospital as a patient. She's been back for other reasons, but not as a patient dealing with her diabetes. And that's just one example of the kind of work that sort of Care Bravely illustrates, I think, for what we do. And there are many, many, many stories like that throughout the organization. And what I love is the fact that our team is using Care Bravely in their everyday vernacular. They're actually using it with each other. They're using it with me. And it continues to really be a point of pride for our organizations. And I hear Care Bravely being used also by our patients. I get letters routinely from patients, some good, some not bad, but it's not uncommon today for me to get a letter, get an email from a board member saying how someone cared bravely for me. They'll say nurse so-and-so really cared about doing a great job and even brought me my favorite meal. He cared bravely for me. And having that language show up, all over the organization has really proved to me that we had developed a purpose that binds our almost 14,000 team members together. If it was just two words without real action, there's no way that Care Bravely would have caught on as it has. But there's action behind it, and I think that's what makes it so powerful.
So you talk about motivation, I suppose. What about and also relation? You said it's motivating. It's relational. Do you feel like it's enhanced the quality of the way people are interacting with the patients, and has it actually helped people care bravely?
Oh, I think it really has. It's funny, during the pandemic, during the now hopefully in the rearview mirror, questioning that,
Hmm.
the words care bravely were, as one of our board members described it, prescient. They said beyond this, they really served as a reminder that this is what we do.
Hmm.
It gave voice to what was already there, a deep desire to care for those that were in need. The work can often be difficult, and COVID-19 was probably the worst of what we face, amplified.
Hmm.
But it also helped focus our leadership and our board members on how do we care bravely for our caregivers. It was our board who stepped up and said, just as the team was caring bravely for our patients in the community, they needed to do something to support the team that was caring for the community themselves. And they put together a group that actually raised close to $2 million to support many of the team members. And it's heartwarming to see that. It was also heartwarming to see that the board embraced the Cure Bravely movement themselves.
Which is perhaps one of the most difficult things, right, with getting the board to.
Absolutely.
But I'm sure
Absolutely.
stories like the one you told about the stove and the woman, and news stories of how people inside the organization are engaging must at least make them feel that there's something in the work you're doing with purpose. And with that, as you turn to the future past COVID, what's in store? How do you look to the challenges ahead, and how do you see the purpose helping you achieve new objectives?
As we look towards the future, we're realizing that so much of what we do is now going to be provided beyond the four walls of the organization,
Mm.
and that we've got to challenge ourselves to figure out how to care bravely out in the community beyond even these 45 different programs that we're offering. And we're looking at things such as medical education and housing and areas that haven't been traditionally under the umbrella of a healthcare system, but areas that we feel are important if we are to really address many of the social determinants that we're facing in our community. We're seeing maternal health not where it should be. We're seeing an explosion of mental health issues.
Mm.
We're seeing issues with teen pregnancy and drug abuse still rampant in some of the communities that we serve. And our focus is to now figure out how we implement our Care Bravely movement out further beyond the four walls in a way that not only our inpatients will embrace it and use those terms, but our outpatients will as well.
This has been a wonderful conversation, Neil. And as we sort of wrap up, I have one final question. If you think of yourself in a few years, you're standing in front of a group of younger CEOs, and you're talking about what you've achieved with your purpose and Care Bravely. What do you feel are the lessons that you can provide to them with regards to how you've been able to engage people within your organization and also people externally?
As I think about the lessons of Care Bravely, one, you need buy-in from the top, and it took some convincing to get our board to buy off on something which has been, which is less traditional than they see our competitors using. Secondarily, getting the leadership to buy off, but then I think really developing work groups within the organization, frontline employees, uh, individuals that can sort of internalize this and begin to share it among their own within the organization, because we realized that we needed the igniters, as we call them, individuals who could sort of create that spark and create that excitement among their peers. When you think about strong organizations of any kind, their longevity isn't based on features or products, but it's really based on a concise set of values that teams can make their own. And this is one of those. Those values turn into thousands of individual decisions, which drive the business. This is where the real value and differentiation and longevity lie. And I think that's the important lesson.
I think that's such a wonderful way to sum everything up. We talked about the emotional, we talked about um, the importance of just feeling the purpose in order to be able to understand all the complexities behind what it represents. And I think you did a lovely job summarizing that. Neil, this has been such a wonderful conversation. Thank you so much for your time being here today, joining us here at the Purpose Power Summit 2022.
Thank you, Scott. I enjoyed the opportunity.
See you again soon.